I had to say what areas are really bothersome to most people when they actually show up in my office, in my clinic, what are the areas that are most bothersome to them? I think if I asked them directly, they would say, it's my smile lines, it's my marionette lines. Now, rather than doing what was done 30 years ago in my career, when we would just go chasing after every line and wrinkle, that's a rather unsophisticated approach these days. What an experienced physician has to do is it has to evaluate the face and see what is actually contributing to those lines. It's one of the most, I have to admit, it's one of the most difficult things to explain to a patient. When they look in the mirror and they see the smile lines and they see the marionette lines, they come in and say, this is what I want done. So I have to sit down, and I usually spend about an hour and a half in my first consultation explaining to them how the face really ages, what really happens in the face that leads to these changes. And once I go through this very, very lengthy explanation, and I say that they have to listen to the lecture, because if they know this, they'll know more than most of the physicians that they visited before. Because what happens is, it is absolutely the loss of volume elsewhere that is contributing to these lines. And if a physician, and usually it's a physician that spent 5 hours or 2 days at a quick seminar, learning how to, didactically learning how to inject things. The point is they'll learn to stick the material in this area and this area. But you know what you can get if you do it directly? Unfortunately, you'll get the face, we call it the simian face, the face of a monkey. Because if you race into these lines and you flatten these lines, the face will look like that of an ape or a monkey that has no smile lines. So that's really not the greatest approach, nor is it a sophisticated approach. Also, by directly putting in the material first into this area, look what it does. It pushes this area up like that to create an artificial, not only flattens this, but pushes this out in an artificial way that isn't the way a person looked in youth. So really, to accomplish treating these things, one must treat the areas of volume loss around it, and I explain which fat pads are lost and what muscle material and what cartilage or what bone, whichever is the specific case, and then I treat those. And then what's left, if there is anything left to treat, I can fine-tune it with small amounts of material to just take care of any small little indentation that may still remain after the real credible treatment has been performed.